Thanks, John, and good morning, everybody. I'm Dave Odie. I'm a professor in the BME department, and I'm the associate director for the strategic research initiatives. Next slide, please. And what we're trying to do is facilitate the development of scientific centers of excellence. And we have so many strengths at the University of Minnesota, the challenge that we have, but the opportunity too, and what we're trying to deliver on in IEM is to try to bring those pieces together. And, when we think of engineering, there are kinds of fundamental approaches to all engineering problems where engineers are capable of making new things, devices, and so forth. We're capable of manipulating systems, of developing advanced instrumentation and technologies for making measurements, and developing computational mathematical models to simulate, design, predict, control systems. At the same time, we're seeing the tremendous advances in just fundamental knowledge of biology, which is already translating into new cellular and molecular therapies and new opportunities for genome engineering. So engineering is happening in biology at the same time. And what we want to do is to bring those together, bring those elements together and have them be impactful for medicine. Next slide. So our strategy has kind of three elements to it. So to do that, to have these multiple pieces, it really involves multiple investigators working around a common problem. And that tends to require funding to make it happen, which is at the center level. Like typically, let's just say in something like $1 million direct cost per year or more. And as I mentioned on the previous slide, that there are so many opportunities at the frontiers of biotechnology that we want to leverage those and build teams that can work at those frontiers so we capitalize on these opportunities. And thirdly, kind of an overall goal of IEM to just keep developing people too, is the next generation of leadership through our doctoral fellowship program is an important element of our strategy for SRI as well. Next slide. So the first one, the centerpiece really is this center accelerator. And we have developed now a capability within IEM and have staff to support it that are able to work with faculty teams, develop their concepts, and do strategic planning, move on to a concrete grant writing timetable to get center level proposals submitted, have them very well written, and get them funded. And ATP Bio is an outstanding example of an exemplar of what this team can support and help make happen. And the impact can be quite substantial and profound for our institution and just for engineering and medicine generally. So it's actually pretty lean, surprisingly. So we have staff support, but they're all fractionally supported. And I'm going to introduce them in a moment. And they're on the conference call today. So a total of 1 FTE. What we're doing is, in the past, IEM has had seed grant funding, and that's been helpful in many ways. It's helped, for example, Physical Sciences and Oncology Center that I lead with others in IEM get off the ground and help make that happen. But it's more intentional now to build an internal consulting firm model that will provide kind of ongoing support to help a portfolio of clients, ideally as large as we can accommodate given our FTE capabilities. And so we're looking for teams that want to do that, and we'll prioritize the center level grant writing, again, at the kind of level that I mentioned earlier. So we'd like to hear your ideas and have them engage with them as we were able to. And we want to actually formalize this process, so we expect to announce more details on that in January or thereabouts, beginning of the year. Okay. So and along with that it's not just staff support. There will be opportunities for funding for research to get the kind of preliminary data to build the relationships that are important to those team efforts. And Bo Connolly, who's the manager for SRI, is the key person to engage at this point with your feedback on this and your concepts. Next slide. Right, so I'm the associate director. I have this able staff here. Each of them is fractionally supported at this point. Bo is the manager of the program. Mike Lottie's been critical as an editor and writer and kind of creating the the timetable for getting grants submitted and very well written. Amanda Hayward is also joined as a project manager and has contributed in both of those respects, strategic planning and also the proposal submission. I'll mention too that we're not doing this in a vacuum. We see opportunities for synergy, and of course we want to avoid redundancy. The Spark program through the OVPR actually is also seeking to support large proposals, and we're looking for opportunities to collaborate with them in ways that synergize with what we're trying to do. Also, the CTSI has clinical research capabilities that we don't have to replicate. We can leverage what they've got. Next slide, please. Here's kind of our current portfolio. So starting on the left, when you have a concept for a bigger initiative, something that goes beyond the usual 1 or 2, maybe 3 investigators submitting an R01 or something like that, and moving into something more like a PO1 or U54 or the NSF ERC, those types of level of funding. It takes more than it's a big effort for one faculty member to do. It has to be done as a team, as John mentioned. It really benefits from experience and support, like the staff that we've developed, and also our IEM leadership is prepared to help provide mentorship guidance on best strategies. So John mentioned ATP Bio. I mentioned Physical Sciences and Oncology Center. These are things that we want to keep developing into the next level. In the case of Physical Sciences and Oncology Center, that grant is coming to an end next year, but it's led to now PO1 submission, which is pending, and there are other proposals related to that will bundle together into a cancer bioengineering initiative. Also, we've got, along with that, in that kind of grant writing stage, 2 T32s that have been submitted. These are excellent opportunities to build collaborative teams across multiple disciplines. Matt Johnson has submitted the neuromodulation one, and Tay Nedoff and Camille Uberbill submitted neuroimaging T32. We've submitted a kind of a rapid response to COVID U01 to do wastewater sampling, which you may have read about. Then in terms of other centers that are preparing to submit large grants, you'll hear later this morning from John Osborne, who's leading the Minnesota Consortium for Autonomic Neuromodulation, MCAN, and Brenda Ogle leads the CCMM, Center for Cardiac Maturation at Multiple Scales, intending to submit a PO1 next year. And we're working with CTSI to see what we can develop in terms of new capability there, like it's so-called optional function that they can add, and that would get them connected to that larger network of CTSAs. And I don't have time to go into it, but we have other projects kind of queued up, but we're getting close to bandwidth limited, and hence we're interested in pursuing opportunities with Spark, for example, to try to expand what we're capable of doing. Next slide, please. Just to kind of give you a sense of how this is working, 2 of the PIs that recently submitted proposals, in this case, Matt Johnson, who submitted the Neuromod T32, just had a lot of positives to say, and I didn't filter out there were no negatives to filter out. This is it. And it really speaks to the kind of team that, Mike Lottie, Amanda Hayward, Bo Connolly are their capabilities in multiple aspects. These proposals are big. They have multiple components. It's not easy to pull them all together, and just getting them submitted, I think this Center Accelerator team makes that more likely and gets it done sooner. And secondly, the quality of the proposal, how well it's written and put together, is much higher. Those 2 together gives us much higher chance that you'll ever get funding to realize these larger initiatives. So that's why it's exciting. On the next slide, please. Similar echoing, again, I did not delete. There were no negative comments to delete. So this is Tay Nedoff's take. And of course, we want feedback too if it's not working. This is a new thing. It's a work in progress, and we'll take that feedback and work with it. Next slide, please. John mentioned ATP Bio, and he can elaborate more. I'm going to try to allow a little time for Q&A here, but basically this becomes a feedback loop to help provide opportunities for things like our Inspire program and our professional education and outreach. Next slide, please. Um, Moving on to our other programs then, we mentioned helping to build the next generation. We've had two cohorts now of engineering and medicine doctoral fellows. This is intended to build off of and is inspired by the university's interdisciplinary doctoral fellowship, but focused on engineering and medicine. And these are really outstanding PhD students in a variety of disciplines, actually, but spanning multiple disciplines and doing innovative work at the frontiers of engineering and medicine. And we intend to build this as a year-over-year cohort model, and we'll bring these awardees back in subsequent years to join with the new cohorts and mentor them and create a community of innovators in engineering and medicine. Next slide, please. As John mentioned, we have Otto Schmidt Distinguished Lecture coming up again with Dr. Wojciech Nowakovic from Columbia. So please join us for that event. Should be great. Next slide, please. And lastly, just talk briefly about COVID response, and John mentioned this, and Jacob and Moss too, but as we all got confronted with this, and we kind of tried to respond rapidly. That was one of the things we think we can do with IEM, is with the funds that we have, we can respond in the moment. It was an opportunity to show what engineers can do to impact in multiple ways an important medical problem. In this case, it was COVID. And we made 14 pilot awards of about 10K size, and initiated a center level planning for a COVID-19 proposal. Next slide, please. We also helped with NSF Rapid Response Awards, and 2 were awarded, one to Megan Kraft for modeling, and one to John Bischoff for detection. Next slide, please. And we didn't do this in a vacuum either. We partnered with other entities like CTSI and the Minnesota Robotics Institute. And by pooling our resources, we could create a pool of seed money to help these projects get off the ground quickly, and within days basically turn around the proposals and make awards if it seemed appropriate. Next slide, please. Here's just 2 slides that give some examples of the awards, and you can kind of read what the topics were and what disciplines the investigators coming from, but you can really see the breadth of IEM membership coming to the fore here. I think it was wonderful to see great concepts coming in from medicine and from engineering, from physical sciences, and even other places like the School of Public Health and so forth. This is a place where IEM can be that kind of hub that can link these elements together and see connections across the university that are there, but maybe need attention. That's what we think we can do. Next slide, please. And just a further listing, and you can see the impact with College of Science and Engineering investigators having an opportunity to apply their technology expertise to this emergent problem we're all facing. Next slide, please. I'll stop there, and I'll leave it to John to decide what our next move is here. I'm happy to answer questions if there's time, or offline, however is best to handle that.
I think we can take a question or 2 if there are any, but I don't see any in the chat at the moment. We can also do it. I think it's fine if we do it a little bit later.